My name is Renee Jansen. I am a nursing student here at the University of Alberta. I've always wanted to be a nurse ever since I was a young girl. I've always wanted to be a nurse, and I was, as I went through school, I decided maybe nursing wasn't going to happen for me, and ended up going another route when I was talking to a career counselor. And she said, "What did you want to be when you were a little girl?" And I said, "A nurse." And she said, "Why aren't you a nurse?" I thought, well, why aren't I a nurse? I can be a nurse. I could do it. So I started researching on the internet, and here I am a few years later. Chemistry, biology, those are all courses that I think will be definitely helpful if you're good in those courses. It doesn't mean you have to be good at it just in high school, be able to get into this program. I mean, that certainly wasn't the case for me. You know, I didn't graduate high school. I had to go back and get my GED and do upgrading. Most of the classes that I've taken thus far have been in classrooms, but also in labs like here, which has been a lot of hands-on and working with people, learning how to communicate, learning how to use all the different technologies. After the four-year collaborative program as a Bachelor of Science in Nursing, that's the great thing about the program, is that it's for 4 years, but really you get a taste of everything. You get to work in maternity, you get to work in an elderly care's home, you get to work in emergency, surgery, ER. You get a taste of everything. At the university itself, there is the Aboriginal Student Services Centre, and that facility and the group of people that work there are fantastic. I mean, all they want to do is help you succeed. Being able to communicate with other professionals, like in the Aboriginal Association of Canada, being affiliated with them, whether it just, even if it's over the internet, you're still connected in that way, and they are also there to support you and get you as far as you can. I do know that I have shift work in the future, and I've never done that before, but I'm gonna give it a try, see what happens. It could work well, but I think we all have to go through that. What happens in a hospital setting doesn't happen just during the daylight hours, and we're all needed at all hours, so I'm willing to be able to do that and to do it well. You don't always have to work in a hospital. You can work in offices, you can work for different government departments, Alberta Health Services. It's not always hands-on clinical kind of care. I am not an extrovert at all, more of an introvert. And I think that not all nurses are extroverts, and that's fine. It's good to have a great mix of different kind of personalities, but I think we all have that certain, flair for organizing and keeping details. It's a feeling that a person might have if you want to care for people. You want to care for a person that might be sick. You want to help them become better again. The exciting thing about it is that I can go anywhere. I can go anywhere in the world. When I first started thinking about this program, and I was like, how great would it be, to take this program, be an RN, and work on a cruise ship, and sail around the world, to do what I want to do, travel, and work at the same time. The longer that I stay in Edmonton, the more that I like it. It was to come down to the big city, get my degree, and go back to a northern community like northern NWT, like Inuvik, where I was born, and care for my people, go back to my community where my roots are, and be able to help them in a different way than I was before.